Good afternoon. Can you hear me okay? It's great. It is truly an honor to be here, and I hope those of you in the audience are appreciative of all the effort that's been made for this conference, and it is really a special effort. And I want to thank Nada and Huma and Shaker for having me come here today. I'm really very pleased to be here and to meet all of you. These are my disclosures. So my talk is more of a soft skill talk. We all started as trainees. We all had to learn new technologies. And in 1988, 36 years ago, I was able to visualize and work with my first EUS scope at the end of my fellowship. And I worked with amazing colleagues who took time to train and to educate me in ways that at that time we were just figuring out how to use the technology. And I've been a teacher and a sponsor and a mentor to many unbelievable women in endoscopy. And I'm going to share with you some of the observations I've made and also some of the tips that I give my colleagues as I go through this. And I have a long list of tips, but they're really more important to just think about where you are in your training, what you want to do, and how are you going to be able to impact the care of the patients who trust their conditions and their lives to you. And I think the most important tip I can give you is remember to keep your patients first. Think about the patient's interests. Think about the person that you're caring for. Speak with your patient before your procedures. Make sure that they have an understanding of what you're trying to do. Educate them. Make them comfortable because they're very anxious. They're being sent to you because they've been told they have a mass in their pancreas. And that just creates all kind of anxiety and fear. And you have the ability to reassure them, to show them that this is probably not a cancer but a cyst. You can use visual aids. You can make drawings for them. And more importantly, you can relax them. And then make sure you convey the right message when you're done with your test. Be truthful with the patient. Tell them what you found, and make sure that they have resources that they can come back, because they're going to be overwhelmed when you give them a diagnosis. They're going to want to talk to somebody. So have a team developed who can work with the patient, can give them the answers, can go over the questions again and again so that they feel comfortable. This will help you tremendously, and it will help your reputation in the community when the patients talk so highly about you because you took the time to explain things to them. The second tip is to really review the medical record, the history before you perform a procedure. You're often sent patients with a specific task, abnormal X-ray, perform a biopsy, an EUS and FNA. But in reality, it helps to have the information of how this evolved. What really happened? You may find out that this mass in the pancreas has been there for years and it's been a cyst that was identified on the CT many years ago. Have imaging to review. Don't just accept the reports. I like to review the imaging before every procedure that I do so I know what unusual anatomy I might experience. I know what exactly is going to be there in the patient. And then carefully review the records once you get them. Make sure you're not missing anything and look for inconsistencies. Was this lesion identified previously? Does this make sense with the patient history? In reviewing the image, you need to become expert at reviewing CT and MRI. As you learn EUS, it's extremely helpful to be able to understand the imaging, to be able to read the CT scans as good as your radiologist, if not better. Specifically when you're looking at organs that they don't really focus on all the time, but we focus on, especially the pancreas. And then review the imaging right before your procedure. If you have questions about the x-rays, go talk to your radiologist and make sure that you and they are in the same alignment, that this is what we're seeing and this is what it means. A good lesson from our hands-on lesson today is to try to know your equipment. Understand the devices that you have. Strive to be the most knowledgeable member of your team. You should know more about the processor than your technicians and your staff. And you need to stay current with the new devices and equipment. Just like the outstanding lectures we just heard, you need to understand the difference between the needles. You need to understand the tools that you have and which one might provide you with better information in a specific spot. And then know how to troubleshoot these problems. If you're having difficulty with getting the needle out of the scope because of the scope position, Yes, go to a smaller needle. Go to an FNA needle instead of an FNB needle. All of these are things that you need to have the knowledge of to improve your ability to care for patients. And then this was probably better highlighted in the ERCP lecture early this morning. Know your capabilities and limits. Work in your comfort zone. If you're not comfortable doing a complicated exam or you can't see a lesion that was identified on x-rays, ask for help. Have a more experienced person work with you. Also work to continuously expand your skill set. If you're getting really good at diagnostic EUS, then it's time to learn how to do tissue acquisition. So start with diagnostic, then you do tissue sampling, cyst therapy perhaps, and finally you're going to be doing invasive therapy in terms of ERCP type procedures with EUS. All of this is a continuum that you can grow and you can learn very carefully with the skills that you have. You have colleagues with more experience than you that can help you along. You can learn from courses and observerships and hands-on training. And just be comfortable where you are. Don't exceed your point of training. If you're just starting with diagnostic EUS, you shouldn't be progressing rapidly to invasive studies. And then build your team. Endoscopy is truly a team sport. You need to have assistants to help you understand what's going on. Respect your team. Treat them as professionals and they will grow and support you. Educate your team. Nowadays, it's so easy to provide education for your team, even if they haven't learned a lot about endoscopy and EUS. There are online resources that you can work with them. They can attend courses. You can send them to other centers. There's lots of ways to develop the individuals that you're working with. And this is so important to your day-to-day existence because this team is going to help you grow, help you understand how to do more complex procedures, and really support you as a physician. You will accomplish much more with a strong team than you ever will with a single individual, no matter how good you are, because the support is so essential to your practice. I want you to follow up your results and your complications. All of us want to collect data to understand what we're doing and how we grow our practice, but know your success rate, know your complication rate. If you don't follow it, you will not know it. Track your experience with new procedures and new devices to see if they truly are better in your hands, and then publish your experience. These are just simple examples of publications below this of series of patients that we've managed at my center that the group has published over time just to show our experience. And that helps your reputation as a young professional being known in the field. And the last tip is getting involved in new devices and trials. It's very important to stay on the cutting edge of when you get started, and being able to be exposed to these new fields and these new devices is really essential for the progress of our field. Working with the new techniques and devices keeps you on the cutting edge, and it encourages you to innovate, to think about ways that you could perhaps do or perform different procedures. So I encourage that significantly. And then become a regional expert. Develop a network of colleagues. Don't be isolated in your own, but actually work with your colleagues. Talk about EUS cases. Present them amongst others, and you'll be able to understand even more quickly what other people think, how they can help you. They help with education and training. Be part of courses like this because it's so essential to continue to educate and train all of our colleagues. If you can, work in the national societies and join committees to focus your career and look for leadership opportunities. It's really exciting to see individuals in the local endoscopy societies progress to the national societies and even on the international stage. I think this is a very important part of your career development. And most importantly, enjoy what you do. Work to develop an environment that allows you to grow. You have an amazing ability to help patients and solve issues and make diagnoses and relieve pain, and all of this can make your life fulfilled as much as it does help your patients. So groom your team to be the best that you can. If you follow your passion, your work will not be a burden, it'll be lovely. And if you love your work, you'll have a great career. So thank you very much for your attention, and be sure to have fun.